I'm Steve Adubato. Welcome to Caucus. It is my pleasure. Welcome back to Public Broadcasting, FiOS, and all of other platforms, to Mike Maron, who is the president and CEO of Holy Name Medical Center. Good to see you, Mike.
Good to see you, Steve.
For those who have followed our discussions, we've talked about a whole range of issues, but I want to talk today about Haiti. Several years ago, you and your colleagues went to Haiti. Why? To do what? Because we're going to update.
So we got more involved. We had been involved, our medical staff had been involved for 20 years. After the earthquake in 2010, they were devastated, got us more involved. It was March 2010, my first personal trip to Haiti. And then in 2012, after cholera and a few other sort of economic setbacks, Holy Names Foundation ended up taking over the CRUDEM Foundation, which supports and runs Hôpital Sacré-Cœur in Milot.
And that hospital is the hospital.
It is the hospital. And right now, today, as we speak, the only hospital, because all the government-run hospitals are on strike. So it is the only facility. It's a 150-bed facility today servicing 2 million people.
Why'd you do this?
Well, we did it because I realized early on, after you and I had gone to Israel together, you reach a point in life that time is short. And when I saw Dr. Butler and Finley and Gewurtzman,
these are part of your team,
our team, come back visibly shaken, I went down and said, you know what, life's short. We don't have a lot of time left. Those of us who have the means to do something have a responsibility to do something. And so we decided to step in.
Mike makes a reference to a trip we went on to Italy. Italy, that was a different trip.
Would have been nice. But
this was Israel with the Berry Foundation, Angelica Berry, part of Making a Difference initiative that we've been partners with for a long time with them, and had a big impact on you, clearly.
Big impact.
We're going to be showing some pictures. Talk about where you and your colleagues are today in the effort to try to make a big difference in Haiti, because while there's been a lot of progress, the challenges are still awesome.
Still awesome. So today we are in the final stages of an OR expansion. We're building 3 new ORs, 4 private rooms, addition onto the hospital. That should be done by July.
What are we looking at right now?
So
are they building up?
That's what they're building. That structure now is much further along. The walls are up, the roof framing is on, and they're putting the sheathing roofing on. HVAC will go in a couple of weeks, painted, and we'll be ready to go.
Mike, describe for folks who don't really understand, and it's our plan to still get down there, or with our production team to actually see it for ourselves, what difference this will make.
It makes a huge difference. So in this area, Milot is in the north of Haiti. It's about 30 miles south of Cap-Haïtien, which is the second largest city. There's 10 million people live in Haiti. 2 million of them are in the north. In the immediate vicinity of Milot, there's about 300,000 people. This is the only medical facility that's there. It is the only economic engine for the entire community. Without the hospital, the ripple effects of other sort of economic proceeds would go away. The whole area would be more devastated than it already is. Haiti is the most impoverished country in the Western Hemisphere. They live in conditions that you couldn't imagine here. People still in dirt floor huts, small, no running water, no electricity. Our facility, we don't get any support. So we have to generate our own electricity. We have to dig our own wells to get water. We have to purify that water. United Water, who has also been Suez has been very supportive.
And now is Suez.
Right. So they have partnered with us in helping to develop water purification systems that are simple but effective for Haiti. And all those partnerships have made a big difference. So all the things that we take for granted here just don't exist there.
It's interesting. Mike talks about the Suez folks. He actually met one of the executives, our good friend Bob Iaculo, not there anymore, but I remember through a conversation we had here in the studio, you were, I think, in the green room, and you had a conversation, and it's just so interesting to me how people connect.
Yeah.
Switching gears, women in Haiti, cervical cancer, big problem, pap smears. Talk about it, because I know there's some progress being made here.
There is. So this was
not enough, but some.
But in terms of Haiti progress, this is light years.
Yeah, put that in perspective.
Okay, so here's a country, 10 million people. There are 4 pathologists in the entire country. 4. 3 of them are in Port-au-Prince. The 4th is with us, and he's a Cuban physician that we just recruited this past year. So when Dr. Santos joined our staff, for the first time, obstetricians, gynecologists are able to do a pap smear, hand the specimen off to a pathologist, and get a reading within days. It used to take 3 to 6 months.
What?
3 to 6 months.
Why?
Because one, there's no pathologist. You have to ship the specimens out, and then you have to wait for the specimen to come back. Now, think about it. There's no real community. While there are communities, there's no street addresses, there's no house addresses. You got to find that patient. So many of these people who had positive findings couldn't be followed up. You didn't know where they went. You didn't know where they came from. And so this allows us to keep people in the community till we have a diagnosis one way or the other, and then to schedule the appropriate interventions. It's a huge benefit.
Yeah, to be really clear on this, we've spoken to many of the physicians who are part of your team. To be really clear here, it's not just money, a significant amount of money. Your physicians, your team, go there, do medical work.
Correct.
Treat patients.
Treat patients. Yeah, so the goal, it's twofold. It's to treat patients, to advance medicine, and to educate the Haitian staff, physicians and nurses that are there so they can get better at what they do. Ultimately, we want them to be self-sustaining. We do not want them to be forever in a dependent state. We're trying to get them independent.
Mike, real quick before I let you out here, one of the other initiatives, because your community has a very large Asian population, Korean population.
Correct.
The Asian Dementia Center is?
It's a screening program. So dementia is one of those syndromes. It's prevalent in the Asian community. It goes undiagnosed because they don't know how to deal with it, cultural differences. So we've created a culturally sensitive program for people to be able to come in, get screened and properly evaluated when they think that dementia might potentially be an issue with an aging parent.
It's important.
Very important.
And being culturally aware, sensitive, and engaged.
Very important, because the nuances in how you communicate and how you diagnose are all driven by cultural sensitivities. You have to be tuned into that. Another great lesson from Haiti, too.
Yeah.
All of these projects have intertwined one way or the other.
No one size fits all.
Exactly.
Mike Maron is the President and Chief Executive Officer of Holy Name Medical Center. Thank you, Mike, not just for being here, but more importantly, for everything you and your team do every day.
Thanks for having me.
Right there. We'll be right back right after this.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the New Jersey Office of the Insurance Fraud Prosecutor, the New Jersey Chamber of Commerce, ADP, the Fidelco Group, Cone Resnick, MagnaCare, and by New Jersey Council of County Colleges. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.